I just laid on my stairs. I couldn't even go any further.
But thanks to technological advances in cardiology, Dr. Mauricio Arruda will be able to fix Bernice's heart in a procedure that is done almost by remote control.
Large magnets sitting around the patient that will allow us to move the catheter from a remote station to assure better contact to the heart tissue during the procedure.
I'm excited, and I'm not afraid. I'll be much stronger, and I'll be able to golf and play and do all the fun things in life.
A life that has new promise, thanks to a dedicated physician, a world-class medical center, and extraordinary medical advances. While the patient, Bernice, is in the other room with catheters in her groin that feed the catheters up to the heart, Dr. Arruda is sitting here at this control panel, and this is what's revolutionary. With two large magnets around Bernice, he's able to manipulate the fine tips of those catheters to precisely where he wants in the heart. He's mapping the electrical conduction of the heart, the highways. The problem is with a lot of arrhythmias, you get too many little roads coming into the main highway. So what he's going to do today is map those accessory roads that don't need to be there, and then come back and frankly zap those to get rid of the electrical conduction that is interfering with the normal electrical conductivity of the heart. Meredith?
Yeah, let me ask you, where are you in the procedure right now? Where is the doctor in the procedure, and how risky is this?
Dr. Arruda, Meredith just asked, how far along in the procedure are you and how risky it is? You have mapped out most of the problem in the heart at this point.
Exactly. Right? Here the geometry of the left upper chamber of the heart is basically reconstructed.
And that upper left chamber of the heart is where all the trouble is right now.
Exactly. Most of the...
And just one of this yellow marker is really the magnet, the direction you're going in.
The magnet field.
And all these little white dots?
Those are the areas that we've been with the catheter and acquired electrical information at this point.
So these are the little areas where you think there might be trouble. And then the bright colors, the green, the red, are the big blood vessels that come into the heart.
Coming from the lungs, yeah.
And so when you get all of this mapped out, you then take that catheter and put radio frequency waves to the end of it, and you start to destroy those little areas that are causing the trouble?
Absolutely. That generates heat into the tissue.
And that heat then destroys the abnormal parts.
Exactly.
You know, Meredith, what's extraordinary about this is in the old times, when I've seen this before, you would stand by the patient and you would try to fix the area by manipulating the catheter in the groin. But it's analogous to trying to write on a piece of paper by holding the pencil by the eraser. It's just relatively imprecise. Through this apparatus that looks more like a video game, you're actually controlling the real tip of the catheter. So we're talking about millimeters, really, really precise. And the hope is that then Bernice will have this area of the heart that's abnormal today zapped. She'll go home and they will monitor her for 2 or 3 months. And the hope is then that abnormal, crazy beating of her heart that's been way too fast, that she'll come back and she'll be normal. That means she won't be exhausted, she won't be short of breath, and it minimizes her risk for stroke and heart attack. But the fact that this could happen in a control room like this, with the patient next door, that is a huge technological breakthrough.
Yeah, what is the success rate for this kind of surgery?
The success rate's about 85%, isn't that right, Dr. Arruda?
85 to 90% nowadays with this particular technology.
And then for the 15% of patients who may not have a complete recovery, sometimes those patients can come back and have this a second time, correct?
It may be required, yes.
And the other cool thing we should say is we all talk about radiation now whenever we have procedures.
Oh, yeah.
Because this is magnetic, the radiation risk to the patient is minimum. It's about 50% of what it would be normally. And the fact that the staff can stand back here, it means also the exposure to the people who are helping the patient is also minimally reduced. We'll follow up with her in a few months, but by all accounts today, what we've seen and the change that's going to happen once they start to pinpoint these little areas, we expect her to do very, very, very well.
And how much longer do you expect the surgery to go on this morning?
Start actually the
Dr. Arruda, what, is it another hour to really get this done?
Yeah, it's probably in another hour should be done. We're about to start the ablation part.
Wow.
Another hour. And we should also say
wow, technology.
This does not require a general anesthetic. You can speak to her, she's fine, drowsy, but this, interestingly, doesn't hurt at all, Mary.
It's amazing to watch it. Dr. Nancy Simon, thank you so
wow,
much.
that is great technology. You can't beat it. did enjoy